Breaking the Silence, Mental Health in Black America. When I first sat down with Leah Lydia, I was struck not just by her brilliance, but by her revolutionary courage. Here was someone who had dedicated her life to addressing one of the most pressing yet overlooked crises in our community: the state of mental health among Black Americans. Leah's groundbreaking work in creating culturally responsive mental health resources hasn't just transformed countless lives, it has fundamentally altered how we approach healing in spaces where darkness too often prevails. She is, without exaggeration, saving lives that our systems have been designed to overlook. The most dangerous silence, she told me, leaning forward with intensity in her eyes, isn't the absence of sound, it's the absence of truth. That truth, we're losing too many of our people, especially our youth, to a mental health crisis that we're still struggling to acknowledge, let alone address. The numbers are staggering, aren't they? Suicide rates rising faster among young African Americans than any other demographic. Depression and anxiety cutting through our communities like invisible hurricanes. And yet we're still whispering about it, if we speak of it at all. I remember sitting in my grandmother's kitchen as a child, listening to the adults talk in hushed tones about cousin Marcus, who was going through something. Nobody ever said what that something was. Depression didn't have a name in our house. Anxiety was just bad nerves. And suicide, that word never crossed anyone's lips. This silence isn't accidental, it's historical, it's cultural. And according to Leah Lydia, is killing us. When survival has been your community's primary goal for generations, she explained, vulnerability can feel like a luxury you can't afford. But here's the paradox that Leah illuminated for me: what once protected us is now poisoning us. The very strength that carried us through centuries of oppression has become, in some ways, our weakness. Because strength without softness, without the ability to acknowledge pain, isn't strength at all. It's armor that eventually crushes the person wearing it. Let's talk about our schools for a moment. According to AA Coma's 2025 State of Youth Mental Health Report that Leah shared with me, 21% of Black youths reported experiencing racial trauma from teachers or school staff. 21%. Let that sink in. These aren't just statistics, these are our children walking into buildings where they should feel safe, only to be wounded by the very people entrusted with their care. One young man in this study described the feeling invisible until I do something wrong. Another spoke of having to be twice as good just to be seen as equal. Day after day, carrying these burdens while trying to learn algebra and literature and history, often a history that erases their own ancestors' contributions. Is it any wonder that nearly one third of these students aren't receiving the mental health care they desperately need? But there's hope in this story too. Schools that implemented culturally responsive support systems, like affinity groups led by trusted adults who look like their students, saw remarkable changes. Rutgers University found that increased belonging reduced suicidal ideation and attempts by up to 35%. 35%. That's not just an improvement, that's lives saved. As Leah powerfully stated, when we create spaces where Black children feel seen, heard, and valued, we're not just improving their mental health, we're preserving their future. But the challenges don't end when our children grow up. In fact, for many, that's when the real struggle begins. Here's another number that should stop us in our tracks. Only 2% of psychiatrists nationwide are Black. 2%. In a country where 13% of the population is African American. In communities where the legacy of medical mistreatment from the Tuskegee experiment to modern day disparities in pain management has created deep, justified mistrust. It's not just about having someone who looks like you, Leah explained. It's about having someone who understands the cultural context of your pain without you having to explain it. Someone who won't pathologize your religious experiences or misinterpret your cultural expressions. This representation gap isn't just inconvenient, it's dangerous. Only 25% of Black Americans seek treatment for mental health issues compared to 40% of whites. And those who do seek help often find themselves explaining their cultural context to therapists who may be well meaning but woefully unprepared to understand the unique intersection of race, trauma, and mental health. But again, there are bright spots emerging. Grassroots organizations have launched mentorship programs encouraging more African American medical students to enter psychiatry. Clinics are actively recruiting diverse providers, and the results speak for themselves. Some cities saw mental health service participation rates double after hiring more culturally competent staff members. As one patient in Leah's research put it, for the first time, I didn't have to translate my experience. I could just live it, process it, and begin to heal from it. This is what treatment by us for us looks like, and it's saving lives. But even with better schools and more representative care, we still face perhaps the most formidable barrier of all: stigma. Despite millions invested in outreach programs since the early COVID years, stigma continues to keep many from seeking help, even as need rises sharply post pandemic. Cultural expectations push some to tough it out rather than admit vulnerability, a mindset reinforced by family, friends, and sometimes even churches unintentionally dismissing symptoms as personal failings or spiritual weaknesses. Pray about it. We tell our struggling loved ones, stay strong, keep pushing. And while faith can indeed be a powerful healing force, it cannot and should not replace professional help when needed. As Leah Lydia so eloquently put it, God gave us prayer, yes, but God also gave us psychiatrists, therapists, and medication. Using all the resources available to you isn't a lack of faith, it's good stewardship of the life you've been given. Community leaders, including faith based organizations, have begun hosting open forums where survivors share their stories publicly without shame or judgment. In one remarkable initiative Leah documented, attendance at local support groups tripled within months of these forums beginning. Teenagers reported greater willingness to ask parents and counselors for support instead of turning inward during crises. Before such initiatives took root, especially outside major cities, few safe spaces existed where pain could be voiced honestly without fear. Now, new partnerships between schools, hospitals, and churches have created lasting networks so no one has to suffer alone. This shifting culture towards openness has already saved lives and continues breaking cycles previously shrouded in silence across generations. But let's be clear, this work isn't just for mental health professionals or community leaders, it's for all of us. Every single person in this room has the power to be part of this transformation. So, what can you do? What can we all do? First, acknowledge the unique mental health challenges facing Black communities. Recognize that systemic racism, cultural stigma, and lack of representation among mental health professionals create barriers that make seeking help even harder than it already is. Understand that these struggles are real and that seeking help is not a sign of weakness, but an act of strength. Second, advocate for culturally competent care and representation in mental health services. Support organizations working to increase diversity among providers. If you're in healthcare, examine your own practices. If you're a parent, ask questions about the mental health resources at your child's school. If you're a church leader, invite mental health professionals to speak to your congregation. And third, perhaps most importantly, break the silence. Combat stigma by creating safe space for vulnerability. Start conversations about mental health at home, at school, among friends. Normalize therapy. Share resources. Check on your strong friends, especially the ones who seem to have it all together. As Leah Lydia reminded me, the strongest people are often the ones suffering the most silently because they've never been taught it's okay not to be okay. I want to leave you with this. Every time we choose silence over truth, we become complicit in a system that has failed too many of our brothers and sisters. Every time we whisper instead of speak, we reinforce the very stigma that is suffocating our community. But every time we speak up, every time we name depression for what it is, every time we acknowledge anxiety is real, every time we talk about suicide prevention openly and honestly, we crack the foundation of that stigma. We create hairline fractures in a wall that has stood for generations. And when enough of us speak, that wall will come tumbling down. The poet Audre Lorde once wrote, "Your silence will not protect you." I would add, not only will it not protect you, but it will not protect your children, your siblings, your parents, your friends, your community. So today, I challenge you to break your silence. Have one honest conversation about mental health this week, just one, with your child, your partner, your parent, your friend. Share a resource, ask a question, offer support without judgment, because our liberation, our true, complete liberation, will never come without healing our minds as well as our bodies and spirits. And that healing begins with our voices. Let us speak until the whispers become conversations, until the conversations become movements, until the movements transform our communities into places where everyone can be whole, be healthy, be human. Our ancestors fought too hard and sacrificed too much for us to lose another generation to a silence we have the power to break. Stand with me, speak with me, heal with me. The time for silence is over. The time for truth has come.